Knock knock.
Come in.
Hi, my name is Ella. I'm gonna be your student nurse today. How are you feeling?
Fine. Everything's fine.
Good. I'm just gonna go ahead and provide you some privacy here. Before we start, can I have you just confirm your full name and date of birth on your armband here?
Marjorie Blanca, 08 26 2002.
Okay, Marjorie Wonka. Okay, 08/26/2002. Awesome. That does match what I have on here. Do you have any allergies at all?
No, any.
Okay. Any food or med allergies?
No.
Environmental, latex, betadine, iodine?
No.
Okay, awesome. That's awesome. Any adhesives?
No.
That's wonderful. All right, I just raised your bed up so that way I can speak to you face to face. Today we're going to be doing a head to toe assessment. Do you know what that is?
Yes.
Okay, yep, we're just going to take an assessment from your head all the way down to your toes, just to get a baseline for your general health. So we'll start with, are you feeling okay today?
Yeah.
Okay, awesome. Do you know where you are?
Yes. In Casper College, Lab.
Okay. Do you know why you're here?
Yeah, for the head to toe assessment.
Okay. And then do you know what the year is?
Yeah, 2025.
Okay, it looks like you're alert to person, place, time, and situation, so you're alert and oriented times 4. I can note that your visual acuity, or that your hearing acuity is good. You can understand me. Your speech isn't slurred, and I can understand you appropriately, which is awesome. And it looks like you can also follow verbal commands just because I've asked you these questions. Have you had any history of anxiety or depression?
No.
Okay. Do you have any have you had any thoughts of harming yourself or others
No.
lately? Okay. Do you have a good support system at home?
Yeah.
Would you say? Okay. Do you have any spiritual or cultural preferences or practices that I should be aware of for this assessment? Awesome. Okay, we'll go ahead and jump into the first part of our physical assessment, which is just taking vitals. Take your right hand on your middle finger here, and that is a pulse oximeter. We're just checking the perfusion in your tissues. I'm going to take this temperature gauge. I'm just going to measure your temperature. Looks like it is 98.9, which is a little bit higher than what we consider to be perfectly normal, but still well within normal range. I'm going to go ahead and take your blood pressure. So I'm going to have you put your hand out. I can feel your brachial artery there. Okay, we want to make sure that's tight on you. Alright, looks like I got a blood pressure of 108/72, which is well within normal range. Does that sound pretty normal for you?
Yeah.
Awesome. Just gonna move right. Alright, looks like that pulse ox is ready as well. Looks like you're at about 98%, which is perfect. Looks like you're oxygenating really well. I'm gonna go ahead and take your pulse, okay? Okay, I got your beats per minute at 84 and your respirations as 16 breaths per minute, which both are well within normal.
Okay.
So we're going to go ahead and look at your eyes, And it also appears that your mood and affect is good. We're not gonna look at your eyes, we'll look at your scalp first. First,
Okay.
I'm just gonna look at your head, just your symmetry in general. It looks like I don't see any, your skin is appropriate for your ethnicity. I'm just gonna feel your face is warm, which is good. I'm not seeing any lumps, bumps, bruises, any masses that are of concern. I'm gonna have you raise your eyebrows and smile, so good facial symmetry. It's equal on both sides. I'm just going to take a look at your scalp. Do you mind if I palpate?
Yeah, there you go.
Sorry. There we go. Okay, I am noting even hair distribution throughout the scalp. Throughout the scalp, I didn't notice any lumps, bumps, bruises, no sort of lesions, bleeding, or any tumors or masses. I also did notice that you don't have any infestations, which is great. What we'll go ahead and do is I'm going to go ahead and assess your eyes to start.
Okay.
So I have my pen light here. I'm just going to assess your pupils. Okay, looks like your pupils are equally round and reactive to light and accommodation, which is good. I don't see any swelling of your eyelids, which is good. Do you have any glasses or contacts or
No.
anything like that? Awesome. I'm going to go ahead and look at your eyes. If you open your eyes a little bit for me. It looks like your sclera is white. Do you mind if I pull down your
No,
conjunctiva? Okay. Alright, looks like it is pink and moist, which is what we want to see. Other eye sclera is white and conjunctiva is pink and moist. We're just gonna check for strabismus and nystagmus. I'll have you cover one of your eyes here, and I'll have you look at my pen, look straight ahead. Alright, uncover your eye. Awesome. And then other eye. And then uncover. Awesome, I'll have you follow my pen. Keep your head in the same spot. Perfect. Okay. Alright, looks like your eyes are great. They're in great condition. I'm going to go ahead and look at your nares as well. If you tilt your head back, perfect. I'm going to look in there. I'm not seeing any rashes, any skin breakdown on the around the outside or in the inside of the nose. I'm not seeing any irregular lumps, bumps, bruises, or any irregular drainage or any sort of blockages in the nose. Do you have a deviated septum? Okay, alright. Looks like the nose does look in good condition, and it also appears to be patent. What I'm going to do is I'm going to cover one of your nostrils. I'll have you breathe through the opposite one.
Okay.
Okay. Alright. Are you experiencing any shortness of breath at all?
No.
Okay. I'm also going to look at just your lips. Looks like they are pink and moist around the edges. I'm not seeing any signs of skin breakdown, any redness, rashes, or any irritation around the lips, which is good. I'm going to have you open your mouth really quick. Alright, looking at the oral mucosa, it appears to be pink and moist, which is what we want to see. I'm not seeing any rashes, lesions, skin breakdown, any bleeding inside your mouth. Looks like you do not have dentures. At your uvula is midline. Do you have any trouble swallowing at all?
No.
None at all? Okay. Looks like your teeth were also in good condition. How often do you go to the dentist?
Once a year.
Once a year? Okay, alright. Yeah, right around. Good. Definitely keeping up with dental care is definitely a good thing. I'm going to go ahead and just palpate your sinuses as well.
Oh.
So I'm going to feel just the front of your face here. Let me know if you feel any swelling or any tenderness or pain. Nothing?
No.
Alright. Alright. Good job. Awesome. It looks like that looks great. I'm going to go ahead and move down to your neck. I don't need my pen light for that. It looks like your neck is it is symmetrical. I'm not seeing any lumps, bumps, bruises, any abnormal lesions or skin breakdown. I'm just going to look and see. I'm going to feel your carotid pulses one at a time. Okay. Okay, I'm not feeling any sort of jugular, or I'm not I feel both of your carotid pulses. I'm not seeing any jugular vein distension, any tracheal deviations. I'm also just going to palpate for any goiters, masses, or enlarged lymph nodes, and I'm not feeling any of that. Did you feel any discomfort while I was doing that?
No.
Okay, it appears that the skin is appropriate for ethnicity, and it is also warm. I'm going to come over to your ears here. We're going to look in there. They appear to be clean around the outside. I'm not seeing any skin breakdown, lesions, bleeding, any irregular drainage coming from the ear. Can we go to your other side here? Same thing, it appears to be clean. I'm not seeing any breakdown or rashes around the ear. I'm not seeing any irritation anywhere. Have you had any hearing changes or decreases in your hearing
No.
at all?
No.
Okay, good to hear. Okay, I'm gonna go ahead and move down. It looks like we already did your neck. So I'm gonna, I also need to palpate your ears.
Yeah.
So I'll go ahead and palpate your ears here. You feeling any tenderness at all?
No.
None at all, okay. Okay, nothing at all?
No.
Good to hear. Okay, we're gonna go ahead and move down to your chest. I'm looking at your chest. It appears to be symmetrical. You're not breathing with any accessory muscles. I'm looking that your skin it appears to be warm and it is appropriate for your ethnicity. I'm not seeing any lumps or masses. I'm not seeing any sort of any bumps or any irregularities to the skin, which is good. How often do you do a breast exam?
Once a month.
About once a month? Awesome. We just want to keep on top of that. Any changes in your breast tissue at all?
No.
Okay, awesome. All right, we definitely just want to look out for things like that. I'm gonna go ahead and listen to your pulses, all your pulses. So we'll go ahead and go through that.
Okay.
We'll start over here with your aortic.
Mhm.
Then your pulmonic. Erb's point. Tricuspid. And mitral valve. Okay. Alright, and then I'm also just going to listen to your apical pulse for 1 full minute. We just want to make sure that you have present S1 and S2 sounds. I'm just going to lay you down a little bit and I'll listen to your apical pulse for 1 minute, okay?
Mhm.
That was 1 full minute of your apical pulse. I couldn't hear any, your S1 and S2 sounds were present. I didn't hear any irregular heart rhythms or anything like that.
Mhm.
I'm also just going to listen to your respiratory tract, okay?
Okay.
Every time you feel my stethoscope move, I'll have you take a big deep breath in and out, okay?
Okay.
Okay, awesome. Looks like you're, I did not hear any crackles or anything like that. Did you feel any discomfort while breathing in?
No.
Nothing like that? Alright, I'll have you just swoop your legs around and I'll go ahead and listen from the back, okay?
Okay.
Okay. Once again, we're going to move in a zigzag pattern down your back. Anytime you feel my stethoscope move, just take that big deep breath in and out, okay?
Okay.
Okay. All right, same thing. Looks like it was great. I'll have you stay in this position, and I'm just going to do a quick back assessment.
Yeah, sure.
Looking at your spine, it appears to be, I don't see any sort of deviations, anything that would indicate that you have any scoliosis, kyphosis, lordosis, anything like that. Have you had any back surgeries?
No.
Okay, I'm going to go ahead and palpate your back. I'm just noticing that it's also warm and appropriate for your skin tone. So we're just going to feel all the way down. All right, any tenderness?
No.
Okay, looking on your back, I don't see any skin breakdown, any lumps, bumps, bruises, or masses. I don't appear to see any surgical sites or anything that would cause any concern or point to any concern for pressure injuries. I don't see any abnormal bruising or bleeding, anything like that. Do you have any troubles with your gait at all?
No.
Okay, I'll have you can go ahead and lay back down for me.
Okay.
And then we're going to go ahead and launch into the abdominal assessment, okay?
Okay, yeah.
Alright. I'm going to lay you down flat here. Alright, I'm going to go ahead and uncover you just a little bit. Okay. Alright, looking at the skin, it appears to be warm. It appears to be dry. I'm not seeing any lumps, bumps, bruises, any abnormal masses. I'm not seeing any distension. The contour appears to be normal. I'm going to go ahead and listen to your bowel sounds.
Yeah, sure.
Do you have pretty regular bowel movements?
Yeah.
Okay. Have you had any issues with constipation?
No.
All right. When was your last bowel movement?
Today in the afternoon.
Today in the afternoon? Awesome.
Yeah, everything fine.
All right. I'm going to go ahead and listen to your bowel sounds starting in the right lower quadrant. You had some very active vowel sounds. If they were absent, I would have listened in each quadrant for 5 minutes, but they were there. I'm going to go ahead and just palpate as well.
Okay.
So I'm going to start with light touch, and you just let me know if you have any discomfort or pain, okay?
Okay.
Right. Just going to start lightly. Again, we started in that right lower quadrant. Okay, any pain or discomfort there?
No, everything fine.
All right, I'll go in again, go a little bit deeper. Okay, and I also noted that you didn't have any bladder distension, which is great. I'm going to go ahead and set you back up. I'm also going to do just a look at your upper extremities as well.
Okay.
Okay. All right, so first I'm just going to palpate your upper extremities. I'm just going to move all the way down. You let me know if you feel any pain or tenderness.
No.
Okay. On both sides. I'm going to go ahead and check your calf refill on both sides. Looks like it is less than 2 seconds. Your skin turgor, it recoils immediately. I noticed looking at you, it looks like your muscles are symmetrical. Your skin is warm and dry. It's appropriate for your ethnicity. Looks like you're perfusing correctly all the way down to your fingertips. I'm not noticing any clubbing, any irregular shaping of your fingernails. Looks like you are doing great. I'm going to go ahead and feel both your radial pulses bilaterally. Okay, and that is great. Awesome. All right, it looks like they are both the same on each side. And then I also forgot to mention your abdomen upon palpation was also warm. So that was awesome. I'm going to do a quick just musculoskeletal assessment and
Okay.
sensor assessment. So I'm going to have you close your eyes and do, which arm was that on?
On my left.
Okay. And what about that one?
Right.
Now you're right. Okay. All right. I'm going to have you push down against my hands. All right, and then push up. All right. I'm going to have you squeeze my hands. Okay. All right. I'm going to have you do this just to test your fine motor skills. Awesome. It looks like your strength is equal on both sides and you're symmetrical fully, which is what we want to see. So looks like we are all set there. I'm going to go ahead and lower you down to the lowest position. I'm going to have you get changed into your gown and we'll do your genitourinary assessment, okay?
Okay, sure.
All right, sounds good. Okay. Okay, I'm gonna go ahead and just perform hand hygiene. Once again, now that I've come back into the room. Okay, and I'm just gonna apply some gloves before I perform this genital urinary assessment. Before we start, have you had any issues with urination recently?
No.
No? Okay. All right, have you had any issues with UTIs, retention, STIs in the past?
No.
Okay. All right. All right, I'm just going to go ahead and uncover you here. Do you mind if I pull up your gown and expose you?
No, go ahead.
Wonderful. Okay. All right, right now I'm looking at the perineum. It appears to be intact. I'm not seeing any skin breakdown, no pressure injuries. I'm not seeing any rashes or any external signs of infection, such as any irregular discharge. The skin is appropriate for ethnicity, and it appears to be warm as well, which is good. I'm gonna go ahead and have you had any discomfort in your genital area recently?
No.
Okay. Have you had any issues voiding at all?
No.
Okay. All right. I'm also not seeing any sort of pressure injuries around your thighs or any rashes around your thighs at all as well. Do you mind if I flip you over on your side?
Yeah, go ahead.
Okay. Okay, right now I'm just looking at your lower back, your coccyx, as well as your backside. It appears that you are in good hygiene back here. Again, I'm not seeing any skin breakdown, any rashes, any external signs of infection or irritation. Looking at your lower back and your coccyx, I'm not seeing any sort of pressure injuries or any causes for any signs for concern there. It appears that once again that your skin is warm and intact, no rashes, lesions, or irregular skin patterns, which is awesome. Do you mind if I flip you back onto your front?
No, go ahead.
Okay, and I'm also looking at the front here. It appears that your hygiene is well. I'm not noticing any, I did not notice any foul odors from your backside or from your perineum or from your coccyx or your lower back, which is great. Let's see. All right, we can go ahead and cover you back up, and then we should be all set.
Okay, perfect. Thank you.
All right, I'll have you get back into bed, and then we can finish the rest of our assessment, okay?
Okay.
All right, I'll lower you back down here. Okay. And then I'll hand hygiene before leaving the room, and then I'll give you some privacy as you change back.
Okay, thank you.
Awesome. Okay, are you still feeling okay?
Yeah, sure.
Awesome. I'll go ahead and hand hygiene since I just came back into the room after you changed. And we'll go ahead and we'll do a lower extremity assessment, and then we'll assess your gait, okay?
Okay.
Okay, just raising you up to an appropriate height here. Okay, are you in a good position?
Yep.
Okay. So what I'm going to do is I'm just going to pull your blanket down. I'll have you swing your legs around to this side. Is that okay?
Yeah, sure.
Okay. All right. Just looking at your legs, they appear to be even on both sides, even muscle tone. They are symmetric. I'm just noting any any scars, any bumps, bruises, anything like that. Looks like you have a couple scars here just on your leg. Where are those from?
From a bicycle I fall.
Just a bike accident?
Yeah.
Okay. Do you have any tenderness? Have those healed over well?
No, they feel very well.
They've healed well? Okay,
Yeah.
good. Awesome. All right, I'm just going to assess your, like I said, muscle tone on each side. I'm not seeing any sort of edema or irregular swelling. I'm going to go ahead and do a brief musculoskeletal assessment. So I'll have you just move your knee up towards your chest. Good, okay. And then I'll have you, good on both sides. And then I'll have you, can you put your leg out like that? Good, and you can do that on the other side. Good range of motion. Okay, I'll go ahead. We're gonna also assess your musculoskeletal assessment down here. So I'll have you push up against my hands and then push down against my hands. Good. Do you feel any weakness or tenderness?
No.
Okay, I'm gonna go ahead and palpate your legs as well. Is that okay?
Yes.
Okay, let me know if you feel any tenderness. Right now I'm feeling for any lumps, bumps, any masses that should not be present, and I'm also assessing for any tenderness that the patient might exhibit. Okay. Feeling all the way down. Okay. All right, I'm gonna go ahead and remove your socks. Is that okay?
Yeah, sure, I can run.
Are you okay?
Yeah.
All right. All right. Looking at your feet, it appears that they are of even skin color, as is the rest of your legs. They are warm upon palpation as I'm feeling them. It appears that your cap refill on your toes is less than 2 seconds, so you're perfusing well in all of your extremities, including your arms up there. I'm not seeing any edema in your feet as well. Do you feel any pain in your feet at all when walking?
No.
Okay, no struggles with your gait. Okay, I'm gonna go ahead and feel your pedal pulses bilaterally. Okay, and then I'm also just gonna do your anterior tibial as well. Okay, awesome. I can feel those both on both sides as well. I'm not seeing, like I said, I'm not seeing any sort of edema. Your skin is appropriate for your ethnicity. You're perfusing well. I'm not seeing any pressure injuries on your feet, on any of your legs, on your backside. I'm not seeing any lumps, bumps, bruises that should not be there, or any no bleeding in any of your extremities. Your toenails are well groomed and trimmed. What I'm going to do is I'm going to have you put your socks on and then put on your non-slip shoes, and I'm just going to assess your gait really quick, okay?
Okay, sure. Just let me put my stuff.
Okay.
All right, done. Where is
Awesome. And I'll have you just walk a few steps that way. Good, and then walk back. Okay. I noticed that you were able to walk in a straight line. I didn't see any issues with your gait. Do you have any issues completing any activities of daily life?
No.
Okay. All right. What I'm going to have you do, we can go ahead and you can go ahead and we're going to get you back in the bed. We can take your shoes back off.
Thank you.
Okay. All right. Okay, and then I'm also just going to do a quick range of motion assessment for your upper extremities as well.
Okay.
Okay, so I'm going to have you, with your right arm, I'm going to have you move your hand up, and then over to I'll have you move back down to the side. Any pain while doing that at all?
No.
Okay, with your other arm, once again, raise it up to the sky, raise it over. All right, no pain in doing that either?
No.
Okay, awesome. I'm glad we were able to get that range of motion in there. Okay, well, it looks like you are in great health. I'm going to go ahead and document all my assessment findings in my chart. So I'm glad that we were able to get this baseline. Do you have any other questions for me at all?
No. Thank you.
Okay, awesome. I'm going to go ahead and perform hand hygiene. I'm going to give you your belongings back.
Oh, thank you so much.
Awesome. I'm just going to perform hand hygiene. I'm going to make sure that all this stuff is put away. Make sure your room is clean and in good condition, like when I found it, which is awesome. I'm going to assess for safety before I leave the room. There is your call light.
Oh, thank you.
All right. I'm going to go ahead and remove privacy. And if you need anything at all, Marjorie, you just let me know, okay?
Yeah, sure.
All right.
Thank
Have
you.
a great day. Bye.
Bye.